All right, it starts with the, this is, let me go back a slide without the arrow. This is cardiac muscle. That's what you got to know. Some people call it cardiac tissue. That's incorrect, because remember, cardiac describes it's muscle tissue. And I might ask you to identify any of these structures here. I'm pointing to one there. Intercalated disc. So know that it's cardiac muscle, not cardiac tissue. That's an intercalated disc. That was the heart. Then we did blood vessels. I might ask you, identify the type of blood vessel. That's an elastic artery. Okay. I might ask you to identify tunics. And I'm pointing to them there in, well, 1, 2, and 3. 1 is pointing to tunica intima. 2 is tunica media, and 3 is tunica adventitia. 4 is pointing to the vasovasorum. That's not a tunic, it's a structure. You know, there's a structure in the tunica intima. It's called the internal elastic lamina, but I don't know if I'd use this slide as an example because I can't see it. I might ask you the tissue types within tunica media. It's elastic fibers and smooth muscle cells. In tunica adventitia, there's also elastic fibers, collagen fibers, and also the vasovasorum. And so depending on how I phrase the question, if I say identify layer, I'm going for tunic. Okay? And here's a closer up picture. I like how you can see the black stuff, that's elastic fibers, and the pinkish stuff is the smooth muscle. And those blood vessels are vasovasorum. Remember, those are blood vessels that supply blood to the big blood vessel. Okay? There's other pictures of arteries that we have. These aren't elastic arteries here. In fact, this is the artery, number 1. And you have to know what kind. It's a muscular artery. Okay? That is a large vein. And so elastic arteries and these blood vessels, we have 3 layers. Okay? TI, TM, and TA. And I have them labeled here. Number 1, tunica intima, tunica media, tunica adventitia. The 1, 2, and 3. This is a good example. It's a muscular artery. I might ask you to identify that black squiggly line, identify structure. That's the internal elastic lamina. Okay, it's a good example of it. And I like how the muscular arteries, it's more pink. That means it has more smooth muscle. That's why they're called muscular arteries. As opposed to this, it's more elastic, right? That's why they call them elastic arteries. Makes sense to me. And number 3, collagen fibers, and whenever you see blackish stuff, that's always going to be elastic tissue. So you have elastic tissue and collagen fibers in the tunica adventitia. Let's look at the large vein up close. If I'm asking you for layers or for tunics, 1 would be tunica intima, tunica media, tunica adventitia. And I could ask you also their contents. It's the same. It's smooth muscle and elastic fibers for the tunica media, and collagen fibers and elastic fibers for the tunica adventitia. So these are the big vessels. They got the 3 layers. So does this one. This is still a muscular artery. It's got the 3 layers, right? TI, TM, and TA, 1, 2, and 3, just like before. Now we get down to a smaller artery. The smallest one are called arterioles. So this is, you can call it a central artery or a central arteriole. It's in the white pulp. And I have on number 2 and number 1 are pointing to the TI and the TM. Because remember, the arteriole, you're down to 2 layers. Going back, this is a different slide, but I have 3 layers. So it's a muscular artery. See all those? Those are red blood cells. I know it stains different, but it's still TI, TM, and TA for this blood vessel. It's from the rat testes. Like it's a good example of a 3-layered muscular artery. This one, how many layers we got? 1. Therefore, what blood vessel is it?
Capillary.
It's a capillary. And they're almost single file, so I call this a capillary. Just a TI. That's all you got. It's still in the rat testes, but it's a good example of a capillary. For a vein, a venule, I should say, that's the central venule. It's in the liver. Okay, that's the only example of a central venule that I could find. There's a closer up picture of the central venule. And I want to move away from blood vessels. So many questions on the blood vessels. Let's do blood. For the blood, just be able to identify the different blood cells. Number 1, pointing to a platelet. Number 2, it's a monocyte. Blue arrow, I can point to that one, or that one, or that one. They're all eosinophils. This is probably the condition, if I asked you what blood condition is eosinophilia. Too many eosinophils. There's one up close. These two are the same. Neutrophils. Both of them are neutrophils. Okay, this is a blood condition. I'm pointing to a microcyte. This is iron deficient anemia. Recognize it as that. Here's 3 things. I know it's kind of like hard to see in the back maybe. A, sickle cell anemia. B, eosinophilia. And this is our iron deficient anemia. Okay, so those are different blood conditions. 2 of them are anemias. Let's see. Once again, sickle cell anemia. If you look closely, look for some of the cells to be puckered or sickled. I may even have you identify like a sickled cell. Okay. Whereas in C, what we saw was the microcytes. That's kind of what I look for when I distinguish the anemias. And for the eosinophilia, look for a lot of eosinophils. You usually don't see more than one in the same view. Okay, number 1, lymphocyte. Lymphocytes look like monocytes, except monocytes have that kidney-shaped nucleus. Number 2, 2-lobe, red granules. Again, it's a eosinophil. So I'm going to move away from blood, and now we're going to get into respiratory. This is trachea. And we went over the layers. We went over number 1, mucosa. Number 2, submucosa. Number 3, adventitia. I could ask you to identify in the mucosa. I have a number of things I'm pointing to here. 1 is just pointing to the epithelial type. And it's got that big long name. It's ciliated, pseudostratified columnar, ET, with the goblet cells. Number 2 is just pointing to a goblet cell. Number 3 is pointing to the base, or the lamina propria, which is like a basement membrane for the epithelium. Now 4 is in the submucosa, but I'm specifically pointing to the structure is the seromucous gland. Getting into the respiratory zone, 1 is pointing to the lumen of a bronchiole. 2 is the hallway, the alveolar duct. Okay. I could have pointed inside there, or inside there. Those are also bronchioles. That looks like a blood vessel right there, though, because I see all the smooth muscle there. But I'm just pointing to these 2 things. So for this slide, that's all you'd have to worry about. I wanted to show you a close-up picture. This is the epithelium of a bronchiole. It's sparse. There's sparse cilia, and it's basically a cuboidal epithelium. Okay, it looks different in the bronchiole compared to the trachea. And we have one disease slide for the bronchiole. So look, this is normal lung. Look at how organized the alveolar spaces are. This is emphysema lung. Do you see a difference?
Yes.
Okay, now if I were to describe the differences, the alveolar structure is broken down. Instead of many small alveoli, which is good, you have fewer alveoli, and the ones you have are larger. And larger isn't better. Larger is more inefficient gas exchange. I'm pointing to one. It hardly even has any structure. I mean, it just looks bad. This is emphysema lung. Okay, that was it. So those are the exact slides I'll use for the quiz, so you have them. And if I went over that and if you have questions, you ask me Monday. One announcement before you leave. We have a lab Monday. I want you to print out the